discuss clinical anatomy of the nose. So the nose, you all know that it is responsible for taking in oxygen and bringing out carbon dioxide. That is one of the major functions of the nose. Second function is to smell any kind of smell. There are thousands of different categories of smell that you can smell, whether good or bad smell. That is the second functions of the nose. The third one is for aesthetics. That means for beautification of the face. You see, I wonder how you are going to look if you don't have nose. Or if your nose is too broad, or too small, or too short. Are you clear? So that means aesthetic is one of the functions of the nose because it adds to the beauty of the face or beauty of our own self. Are you clear? Good. So now since we have seen the major functions of the nose, so one of the major things that can affect the nose is a trauma. So you see, trauma can affect any part of our own body. So once somebody has a trauma on the nose, you know that nose entirely is made up of a cartilage. And that cartilage is a high-lying cartilage. And so it can get destroyed as a result of trauma or trauma using a sharp object like a knife or something that is very pointed like an arrow. You get it? So it can tear the cartilage or injure the cartilage. And you know, one funny thing is that the cartilage now, once it has been damaged, it is very, very difficult for it to, get, repaired because cartilage do not have blood supply. They can only get nutrients through diffusion from the surrounding blood vessels. And so that is why once they get damaged, it is very, very difficult to get it repaired. You can only use the skin around to patch the damaged area rather than, reconstructing the cartilage itself. So again, the nose can bleed, especially for young children. They used to pick their own nose using the finger to pick it up, to remove something inside like dried mucus. Even adults, they tend to do it to pick their nose. And by so doing, since the nose is dry, you can at the same time try to scratch. When you're scratching the inside of the nose, you may be unlucky to scratch or tear some of the blood vessels in there. So the nose will be bleeding. That's what we call Little's area in the anterior part of the nasal, septum. So at the inferior aspect of the anterior part of the nasal septum, that area is very well vascularized, and so it is called Little's area. And that is the commonest area where epistaxis tend to take place because the area is highly vascularized there. The area of anastomosis of many vessels, and so that area is the area of bleeding, of the area of epistaxis. So during dry weather, the nose can bleed. It can affect anybody. And so the way to curtail that or to stop that is for you to raise up your head like this and then try to catch hold of the two nasal cartilage like this, to hold the breath for some time and open your mouth to breathe with your mouth. And so for 2-3 minutes, the bleeding may likely stop. Or you can get what we call ice pack compress. So you now get an ice pack, you put it on the nose, you compress the nose that is bleeding, you compress that side. So within 1-2 minutes, the area, because the vessel will get vasoconstriction as a result of that cold, water or ice that you use to compress. So the blood vessel will constrict, they will get vasoconstricted, and so the bleeding will stop. Similarly, you can use some, nasal drops. The nasal drops, you can put it on a cotton wool, and then you put it in the nostril that is bleeding. So you put the cotton wool there together with the nasal drop, that will control the bleeding. It has some chemical, the epinephrine component of it will now, go and act on the blood vessels so that, it gets vasoconstricted and to constrict the area. And so the nose can also get infected as a result of maybe corona. You know, we recently had corona. As a result of catarrh, you know, Barhamella catarrhalis is a microorganism, you know, that affects the nose, and it can cause a catarrh. And so the catarrh can also, you know, block, you know, the nose. So the infection or inflammation of the nose, that is what we call rhinitis. So rhinitis is the inflammation. Rhinos means nose. So rhinitis, we're talking about the, you know, the inflammation of the nose. Similarly, the smell by the nose can be abnormal. Abnormal nasal, abnormal smell, you know, the nose can, at times, occasionally, it may not be able to smell the smell around completely. So if you bring something very smelly in this room, the person that has that condition may not likely smell it at all. That is what we call anosmia. Total loss of smell. Total loss of smell, that is what we call anosmia. But at times, the amount of smell that one nose will smell is going to be lower than the other nose. That is what we call hyposmia. That means that there is decrease in the amount of smell someone is going to smell. So at times the smell can also be exaggerated. The smell is very small in the room you are, but one will feel it as if it is very, you know, very big smell, you know. That is what you call hyposmia. Hyposmia. So, as I told you previously in the other video, when I told you about the fracture at the base of the skull, you know, the CSF, cerebrospinal fluid, may start coming out of the base of the skull and cause what we call rhinorrhea. That means CSF may be dropping out of the nose. That is rhinorrhea. So that is as a result of accident. When somebody has a fracture at the base of the skull, the meninges are torn, and the CSF will now start dripping at the, you know, at the site of the fracture. You can also have some nasal blockage. The nostrils can get blocked as a result of tumor, cancer of the nose. So the nasal membrane or mucosal membrane of the nose can get cancerous. Cancer can affect the nasal mucosa of the nose, and so the cancer can block the nose so that you cannot smell anything, and you cannot breathe well with that nose. And also foreign body. You know, some small kids, they tend to use beads, charibi, to put in the, as they are playing, or even small object that can go into the nose. They can use it to block it. To them, it's nothing because they don't know what they are doing. So foreign body can block the nose, and it may get out of the nose to go into the pharynx or into even the larynx and cause some respiratory problems and what have you. Even blood, as a result of this bleeding, epistaxis, at times the blood may clot, and the blood clot may be very large, and then it may block the nose. So the nasal blockage can be as a result of blood clot, as a result of epistaxis. And you know, apart from that, mucus, when you have serious catarrh that is very, very thick, that mucus can get dried, and then the mucus can now block, tasono etaru, can block, you know, the nose. And by so if the two nostrils are blocked, the breathing with the nose will be difficult. So you will see people breathing with their own mouths open, mouth breathing, as a result of nasal blockage. So by so doing, you can do it, you can unblock it yourself if you think it is something that is simple, or you think that is something that is not serious. If it is something that you cannot do, if it is in small children, when they put this foreign body inside, don't attempt to remove it. Try and take that person to the clinic for removal, because in trying to remove, you may at times try to push it back, and only God knows why it may go. It may go directly into the larynx and go into the respiratory tract and cause respiratory difficulties. Are you clear? So by and large, for the nose, you know, it's not as much as the eye and other places of the face. So I am just going to have a break. Until next time, I'm going to discuss another clinical anatomy of the head and the neck.